You know, I think the rhetoric was very nice in terms of the healthcare reform bill that was passed earlier this year. Unfortunately, the reality does not match the rhetoric. I think there's so many reforms that were needed that can actually have an effect on reducing healthcare costs on the American people, but this bill that passed didn't do it, doesn't do it. I am disappointed that the Congress didn't take up things such as medical malpractice tort reform, such as allowing the interstate sale of health insurance, such as reforming the tax code to allow for an individual deduction for health insurance costs. These are real reforms that I think would have helped the American people. Unfortunately, the bill that passed, I think, is going to only lead to rapid consolidation in industry and eventually a de facto single-payer system in healthcare for our nation. No, unfortunately, I think what this law does is it spends a lot of taxpayer money, expands the size of the bureaucracy. I mean, we're looking at expenditures of $1 trillion of the people's money for this Healthcare Reform Act. And the savings are all hoped for, planned for, but I think to date certainly have not materialized. I don't see anything in the near future that will have them materialize. And the reason for that is because it's not incorporating any of these real reforms that I had talked about to actually drive down costs. All it's doing is expanding the size of government, expanding the amount of taxpayer expenditures without corresponding market mechanisms to try to hold down costs. You know, I think medical malpractice tort reform is one of the most essential things we need to fix healthcare in America. You know, unfortunately for too many medical doctors, medical malpractice insurance is the single largest cost of the practice of medicine and is the fastest rising cost for most medical professionals today. The reality, though, here is that current majority in Congress, I believe, has been captured by the trial lawyers bar, and there's far more interest in protecting the lawyers in healthcare than there is in making sure that medical professionals can treat patients in the healthcare arena. And I think that's unfortunate, and it's one of the biggest flaws, I believe, in the medical health reform bill that just passed. You know, I believe that the best way to approach this, honestly, is for the Congress to repeal or at least dramatically reform the healthcare bill. You know, I say this as an attorney. Going into litigation, the only winners are going to be lawyers, however this is adjudicated. And what concerns me about taking the judicial path is this is something that's going to take years to resolve. A far more effective and much better approach to this here is that it should be resolved in the legislative branch of government, not the judicial branch of government. So it doesn't mean I disagree with the lawsuit. I just think the better approach here is for Congress to repeal and replace, or at least dramatically reform the bill. You know, I think there's a lot of concern amongst the American people generally, and also my constituents in the state of Hawaii. People, I think, are legitimately concerned that this measure is going to expand government, increase the amount of overall expenditures, expand our deficit, and not provide any meaningful savings to the people. Over the long term, I think there's a very legitimate concern that what's going to happen is a rapid consolidation of the health insurance industry, and over the long term, you're going to get a de facto one-payer system that nobody really wants. This isn't good for America, it isn't good for my district in Hawaii, and that's why I'm a very big proponent of dramatically changing this law.